is Meg. I'm your nurse today. I'm just going to sanitize my hands here real quick. How you doing today?
Good.
Can you tell me your name and date of birth?
Shannon Beardman, 9980.
Perfect. And I'll just check your wristband as well. Thank you. All right. And can you tell me why you're here today?
I have a headache.
Okay. And where are you at?
I'm at Century Hospital.
Perfect. And do you know what day it is?
It's Wednesday.
And the time of day?
Morning.
Perfect. All right. That's good. I'm going to do a head-to-toe assessment on you. So that's going to be examining your whole body, checking your pulses, checking your vitals, everything like that, and asking you some questions as well.
Okay.
Are there any cultural considerations that I should be aware of? Any privacy concerns, anything like that? All right. Thank you. I'm going to start by checking your eyes. So I'm checking your pupils first for size and symmetry. So pupils are equal. Size is about 4 millimeters. That looks good. And then I'm going to shine a bright light in your eyes to check if they react. All right, other side. All right, thank you. And then I'm going to have you look at the end of my pen light and then look at that far wall right at that sprinkler. So look at the sprinkler and then pen light. Perfect. So the pupils are accommodating. They are getting smaller when you look at the light, the pen light. And then I'm going to have you follow this, just checking your extraocular movements. That all looks good. That is smooth. They're not jumping around. So that looks good. So pupils are equal, round, reactive, and accommodating. And I'm going to check your peripheral vision as well. Tell me when you can see it.
Yep.
All right, side. Tell me when you can see it. Yep. Perfect. Thank you. All right, and then I am going to start with feeling your pulses right in your temples here.
Okay.
All right, those are equal. And then can I look in your nose and your mouth real quick? Perfect. Thank you. All right, nares are clear, mucous membranes are moist and pink, teeth are intact, and I'm going to check your carotid pulses as well.
Okay.
So one at a time. All right, and I don't notice any jugular vein distension as well. Checking your skin and your hair on your face. On your head, everything looks good, hair is clean, general appearance and hygiene is good, and mood is appropriate for the situation. So I'm going to move on with my assessment. So I am going to first check your upper extremities. So I'm going to take the pulses on the inside of your arms. I have to press a little bit hard here, so. All right, those are good, equal. All right, checking your radial pulses. Perfect, equal and good. Can you feel when I'm touching you? Yep. All right, and do you notice any numbness or tingling? No. Okay, I'm going to check cap refill, make sure that's less than 3 seconds. And then I'm going to have you squeeze my fingers. Perfect, and then I'm going to have you pull against my hands and push. Excellent. All right, that's all good. Check brachial and radial pulses. And then I'm going to move on to your chest. So I'm going to listen to your heart sounds first, and then I'm going to listen to your lung sounds, okay? Okay. All right. So for heart sounds, I'm going to listen to aortic and pulmonic. So aortic, second intercal, in between the ribs space, and on the right sternal border, and then same on the left. Then I'm going to go down to the 5th intercostal space on the left sternal border for the tricuspid, and over here for the mitral. It's all good. And then I'm going to listen to your lung sounds. So you can take just deep, steady breaths, and I will move my stethoscope. So up here, I'm listening to the bronchial lung sounds, and then next to, I'm listening to the bronchiovestibular, and then following down on the intercostal spaces, making sure I'm not going over bones. These are all the vesicular lung sounds. And then I'm going to have you lean forward and cross your arms in front of your chest. And I'm going to listen to your lung sounds on the back as well. So I'm listening to the bronchiovesicular up here, and then the vesicular going down, making sure I'm not putting my stethoscope over bone. That's all good. All right, lung sounds are clear, equal, and not diminished. You can lay back, thank you. Have you noticed any shortness of breath or trouble breathing lately?
Nope.
Excellent. All right, I'm going to lift your belly as well. Pull this up, thank you. So I'm going to look first and make sure I'm not noticing any distension there, and then I'm going to palpate gently. Have you had any pain recently?
Nope.
Okay. All right. Oh shit, I gotta auscultate before I palpate. Sorry. Let me back up, and I'm gonna auscultate for bowel sounds. And I'm gonna listen for about 30 seconds, listening to hear bowel sounds every 5 to 10 seconds. And if I don't hear anything, I'd listen to a full minute to make sure to make sure they actually are absent. And then after I finish auscultating, I would palpate. So palpating the abdomen here. Any pain when I'm doing this?
No.
All right, abdomen is soft and non-tender. Examining the skin, as well as the skin on the rest of the upper body. It is warm, intact, and color is appropriate for ethnicity. Can you tell me about your most recent bowel movement? When was that?
This morning.
This morning, and is that pretty regular, once a day for you?
Yep.
And was it soft, loose, formed?
Formed.
Okay. Any bleeding or anything associated with that?
No.
Nausea, vomiting lately?
No.
Excellent. And then have you been voiding appropriately? Any problems with urination,
No.
frequency, urgency, pain?
No.
Perfect. Any sexual health concerns?
No.
Okay. And I would examine that area if necessary. And then I would take your femoral pulses on the insides of your legs here. All right, and then I would take popliteal pulses, back of the knees. Reach around and take posterior tibial pulses here, and dorsalis pedis pulses, top of the foot. Making sure all of those are equal, strong, they aren't diminished going down the legs. Examining the legs, making sure I'm not noticing any lesions or discoloration there, making sure to check for edema in the lower limbs especially. I'll check my cap refill again here, make sure it's still less than 3 seconds. And then I will check, can you feel when I'm touching you? Yep. On this side? Yep. Perfect. And then I'm going to have you press down. Perfect. Have you pull up? Awesome. All right, and that is equal and strong. All right, so that looks great. I'm gonna have you move over to the side of the bed here. Sanitize my hands real quick. And do you feel dizzy at all?
Nope.
All right. I'm just gonna check your gait and your balance. So I'll have you stand up, walk to the door, and then come back and sit down. Perfect. All right, gait is even. I'm not noticing any concerns there. So I'll have you face me and hold your arms out in front of you. Perfect, close your eyes. And then I'm just noticing for 30 seconds, noticing if there's any drift. You can open your eyes, all good. And then I'll just have you copy me, checking your coordination here. Perfect, looks great. All right, you can have a seat. All right, and do you have any other concerns for me while I'm here?
Nope.
And what would you rate your pain on a scale of 1 to 10?
It's like a 4.
A 4? Okay. And then I do have vital signs here, we took beforehand, so that is all good. All right, well, I will see you soon.
Thank you.
All right, and then I would make sure I'm documenting and we're all sanitize my hands as I'm leaving.